Hi, so I'm Joanna Dixon, and you may have seen that I did the 24 questions with Lorraine from the Thyroid Trust. So I'm really delighted today to welcome Judith Taylor, who's the Chair of Trustees for the Thyroid Trust, to go through 24 questions with her. So just to...
Thank you, Joanna. Looking forward to it.
Fabulous. So just to make a start so that we can get to know a little bit about you, what's your favourite word, Judith?
Well, this might make you laugh, but my favourite word is hope. Because if you're a thyroid cancer survivor, it is so important to anyone with a diagnosis of cancer or another serious condition. And also because in my case, I used to take part in the Relay for Life. And when the sun goes down at the Relay for Life, these amazing candles, the luminaria as they're called, light up and they make the word hope.
Oh, how fabulous.
So that to me is why it's so important.
Oh, fabulous. And that was my favourite word as well. Yes,
I gathered that. And you've got a dog called Hope.
I've got a little dog called Hope. Yeah, she made an appearance. Yeah.
Right. Yes, and I have a dog called Poppy, but I didn't really think I could say that was my favourite word.
No, well, that's why Hope was named Hope. And I got her about 6 months after diagnosis. So, yeah. So what's the nicest thing anyone's ever done for you then?
My daughter, who was aged 10 at the time, helped me to give up smoking. And she was so courageous, and she hid the cigarettes. I told her to hide them, but when I asked her to give them back to me, she refused. And I think it was the bravest thing anyone's ever done for me. And that was almost exactly 20 years ago, September the 20th, I think it was, in the year 2000.
Excellent. Excellent. Oh, a brave little girl. Yeah, I hope you didn't get cross with her when she wouldn't tell you where they were.
Oh, I got absolutely furious.
Okay, so probably a very busy lady, and I think we're going to talk a bit later on about your work. So what do you like to do in your downtime? What's your favourite activity to do at a weekend?
I don't really have weekends. Because strictly speaking, I suppose I'm retired. I'm retired from a main job, and the weeks and weekdays and the weekends sort of run into each other. So sometimes I prefer to do something nice in the week and catch up with my work and other activities at the weekend.
Yeah,
actually, especially during lockdown, because our social life is so much more limited.
Yeah.
So one of my favourite activities, generally, I like walking Poppy, my dog. I like swimming when I can get to it. I do some family history research, and I do some writing. So that's the kind of things that I occupy myself with in my free time.
Fabulous. So so that's your free time. So obviously, as I said at the beginning, you're the Chair of Trustees for the Thyroid Trust. So can you tell us a little bit about what that role involves?
Well, as a trustee, we have a role to supervise the activities of the trust, to help Lorraine when she has questions or wants to weigh up some issues. I chair the meetings of the trustees. I help to keep an eye on the finances and generally brainstorm about future activities, for example.
Right. And are you involved in any other thyroid-based organisations?
Yes, I'm also a co-director and secretary of the Thyroid Cancer Alliance. The Thyroid Cancer Alliance is an umbrella organisation for about 10 national thyroid organisations and thyroid cancer organisations representing patients spread all around the world. The Thyroid Trust is one of the members, and we have members in Peru, in Argentina, in Mexico, in Bulgaria, France, Spain, and the Netherlands, for example.
Oh, so that's really good, isn't it, to get that kind of broader view rather than just be looking at what's happening in the UK. And I suppose there's a lot to be learned from, from other organisations and other countries, isn't there?
Absolutely, yes. We can brainstorm with each other. We can exchange ideas. We get to meet from time to time. This past year, of course, we haven't been meeting, but we do go to scientific and medical conferences where we can exhibit and network with people and attend the scientific sessions and also talk to each other. We usually hold our AGMs at these meetings, although we'll be holding it online this year.
Yeah. So how did you become involved in that then?
Well, I suppose it was started when I was a volunteer for the British Thyroid Foundation. I used to edit their newsletter, and I wrote and edited their patient information. I became a trustee. So as a BTF trustee, I was asked to represent the BTF in the Thyroid Cancer Alliance when it was first formed. So that is how I got involved in the TCA. It's also really how I got involved in the Thyroid Trust, because the BTF wanted to have a patient support group in London, and Lorraine very kindly offered to take this on. When she stepped down as coordinator, another coordinator was appointed, and well, it's a long story, but eventually Lorraine came back. And with the help of a sponsor, Lord Jamie Borwick, the London group was re-established as an independent group and is now a charity, the Thyroid Trust.
Yeah.
I was involved in the Thyroid Trust and in the BTF group meetings from the very early days, because I used to go and attend the meetings, which were at that time in the Royal Free Hospital in London, and sometimes spoke at them. And got to know people, and it's a very good network, I find.
Fabulous. Okay. So, obviously, these days we're quite reliant on social media. And for example, I've been doing some work with social media for the Trust this month for Thyroid Cancer Awareness. So, what do you think about social media? What do you honestly think about it?
I love it and I hate it in parts. I'm really invested in Facebook, as I've got nearly 300 friends and acquaintances on there. It helps me to keep in touch with family members and friends all over the globe, in Canada, Australia. And I love posting pictures of my dog and family activities and seeing what other people are up to. And I also run a Facebook page for the Thyroid Cancer Alliance. I'm also on Twitter, and although I'm a bit less invested in that, I find it very useful for keeping up to date with the science, and also at the same time posting articles of interest to other people, especially on thyroid cancer. I go under the name of Endo Editor, so it covers the whole of endocrinology. But I have to say that I dislike Instagram. It seems to me to be really much more of a vanity platform than Facebook and Twitter.
Okay, so
that answers your question. I'm curious what you think of social media.
It's pretty much the same. I mean, I've got a 15-year-old daughter, so she's kind of, almost grown up, not knowing anything other than social media. And when me and Lorraine were talking about it, kind of similar things to you, that in terms of being able to keep in touch with people and reconnect with people, it's amazing. And to be able to kind of reach that wider audience through whichever kind of platform it is, for awareness. So, across all, it's been really good to see how much awareness there has been around Thyroid Cancer Month this month. And I think there's more than there was this time last year. But yeah, again, on the flip side of it, as I said, I've got a 15-year-old daughter. And is it necessarily the best thing that they're growing up in what can sometimes be portrayed as an artificial world, really, where everybody's airbrushed and everybody posts a perfect life?
Exactly. That's exactly my feeling about Instagram. Yes.
Yeah. It's unrealistic, and it can feel unachievable. So, it's like anything, isn't it? There's pluses and minuses to it. So, obviously, you said that you'd retired, but it sounds like you're busier now you're retired than you were probably when you were working. So, either in work or actually post-retirement with the kind of work that you do now, what's the kind of one thing that your work has taught you that kind of helps you in the rest of your life, would you say?
Well, it's very difficult to pinpoint just one thing, of course. I worked as a scientific and medical publisher. So one thing that it's done is to keep me in contact with the science and dealing with physicians, for example. I ran a program of journals and books, and many of my editors and editorial board members were clinical researchers. And so I developed the experience of being able to communicate with them pretty much on an equal basis, because each of us had our expertise. They had expertise as a clinician, I had expertise as a publisher. So we met in the middle. I think in terms of working with my colleagues, the word that comes to mind is empowerment. Because I grew through working in the company to eventually become a director. I did some fantastic management training courses. They taught me how to manage a team and to deal with my team members, and to empower me to present strategic plans, to talk with my colleagues, my team and others. And it was really the backbone of my existence there.
Okay, so who would you put a shout out to then? Somebody that you either work with now or again that you worked with previously, who you feel is a kind of unsung superstar, an unsung hero?
That's a really difficult question to answer, because all of the authors and editors that I dealt with were pretty important people in their own right, so they were not exactly unsung. Mm-hmm. Well, I dealt with some really impressive figures, even Nobel Prize winners from time to time.
Oh, goodness.
And within the company, I really wouldn't like to pick out any one individual. There are a number of people who were very important to me at the time. Actually, I think I would rather leave that question unanswered, because
I found it really difficult when Lorraine asked me, and I went for a group of people rather than than an individual person, because I think you're right, it is kind of quite difficult, really. So Lorraine was telling me that you have a passion for singing.
What Lorraine may not know, however, is that it's very closely tied in with my experience as a thyroid cancer survivor, because I was diagnosed when I was 15. And although I wasn't told anything about what I had, the surgeon did take care to warn me that I could lose my singing voice. He knew that I was a keen singer. So after the operation, he came along to my room and said he was really sorry, but he thought he had nicked one of my vocal cords, or the nerve that controls the voice box. So I was determined to prove him wrong. And for the whole week, in those days, you stayed in hospital for quite a long time. I think in my case, it was about 10 days after surgery. So for the whole of the first week, I just tried and tried and tried to sing a scale. And I finally succeeded, and the nurse went flying along to the surgeon's office, which wasn't very far from my room, and said, she's singing, she's singing. And I went back to school, and I was able to get back into the school choir and had a small solo in our end of year musical. And I carried on singing after that. At the time of my second surgery, which was 17 years later, and I was living in Holland, I again was warned that I could lose my voice. In fact, the chance was even greater the second time. But although my voice was pretty rough afterwards, I had voice coaching. It took me about 9 months for my voice to recover. And I actually auditioned successfully for one of the most prestigious amateur choirs in the Netherlands at that time, which was the Concertgebouw Choir. And I sang with them happily for about 7 years, as well as in several other choirs, right up to the present. I sing in a local church choir, and I've just joined a project choir. We're singing the works of Carl Jenkins, and we rehearse on Zoom.
Oh, well, yeah, you've seen that a lot, haven't you, recently, with the lockdown and everything? Yeah, yeah. But I mean, that's an amazing story, isn't it? I remember being told the same, and I think my voice is different. If I listen back to things pre-surgery, I think my voice is weaker than it was. But I'm by no means a good singer, but I'm a car singer and a shower singer. And I did find it really difficult at first. It is quite, distressing, isn't it, when there's no noise coming out? So. Well,
yes, and that's exactly what happened with me. My voice was very husky to begin with, and the voice coaching helped me enormously, and it helped me not go too far, because I had a friend actually who made me practice reading stories to my son and pitching my voice higher and higher, and he also helped me to restrict my singing to just 5 notes. Mm-hmm. So that's what I did for the first 6 months after my surgery.
Yeah.
My voice has gotten lower since then. I used to be a soprano, I'm now an alto, but I can still sing.
Yeah. And that's fabulous, isn't it? And if it's something, that you have a passion for, that's great. So
it brings so much joy to my life.
Mm-hmm. So aside from singing then, have you got any other hidden talents we should know about?
I'm not sure it's exactly hidden, but I do write for a living. I mean, since I was actually let go from my the job that I'd held for about 30 years with the medical publisher, because my job moved to the States. And so I was let go with a fairly handsome arrangement. I could afford not to work. So I started writing, and I did some volunteer writing for several patient organizations, mostly patient information leaflets and so on. And I also do some family history research. I'm working on an article at the moment about someone who's buried near here, and I discovered he came from Virginia and grew tobacco. So these are the kind of things that I like to do. I also have a paying job now. I do actually work for a former colleague and do what we call science to public writing, which means you look at a scientific article and you write a short blurb about it to explain what that science means to the lay person.
Oh, which is really important, isn't it? Mm-hmm. So important.
It's becoming more and more important, yes, and I love doing it. It gives you a great feeling of satisfaction.
Yeah, and I think as people have, you know, from as people have more access to more information with the internet,
Mm-hmm.
why it's really important, isn't it, now? Because people can go and access this information, but it doesn't necessarily mean anything to them, does it?
Well, not only that, it's very easy for people to access what you might call the wrong information.
Yeah.
It's important that people learn to identify good information and what are the signs to look for to understand whether it is properly validated.
Mm-hmm. Okay, so you've probably kind of already answered this question anyway. So what makes you so passionate about thyroid cancer awareness?
Well, something that I haven't told you is that when I was first diagnosed, no one told me that I had thyroid cancer. And although my parents knew, they held that back from me. And in fact, when I asked once, is it cancer? I can remember my mother flinching and saying, no, nothing like that. And I think the reason for that is, you probably weren't even alive then, but this was in 1965. And in those days, people didn't talk about cancer or even the suicide, as they used to say. They would sometimes talk about something bad or something nasty, but that didn't mean anything to me. Really didn't know what that meant. But there was this nagging anxiety. What's really wrong with me? Am I going to get better? What's my future? I did manage to convince myself at one time that I was going to die before I reached the age of 30. So what I would really like people to experience is what I missed, and to have access to good information, good reliable information that explains their condition to them.
Absolutely. So, as you'll probably know, as I know, there are kind of different types of thyroid cancer. So do you know what type of thyroid cancer you had?
Well, I do now.
You do now, yeah.
Yes, because at the time of my second diagnosis, everything came out into the open, and so I learned a lot that I hadn't been told before. So I was diagnosed with what's called a follicular variant of papillary cancer, which is a type of differentiated thyroid cancer. And this type of cancer, all of the differentiated thyroid cancers, are considered to be fairly easily treatable and to have a good prognosis. The 10-year survival, I think, is over 90%. So there really is no reason why I shouldn't have been told when I was diagnosed that, hey, it is cancer, but you're going to survive it.
Yeah.
And what I would really, really like people to know, what I would not like them to know, is that it's a good cancer. Because a lot of doctors hide behind telling their patients that they have cancer by saying it's a good cancer. And that is really, really annoying, because although it may be easily treatable, there are a number of side effects, some of which can affect people for their whole life. And it's really important that people get the right information and reliable information about what can happen as a result of surgery or as a result of radioactive iodine treatment, so that they can be helped to deal with those conditions. Some people also suffer from problems getting back into the workforce, or getting life insurance or travel insurance. And I think it's really important to be able to support people through these kinds of issues.
The doctor who gave me my diagnosis actually said to me, if I had to have cancer, this is the one I'd choose.
Oh, what was your reaction?
Well, I won't say on here. Yeah.
I know that doctors think that this is going to be reassuring to patients, but it is really annoying, and it's not completely accurate because they refrain from telling you about the possible side effects or the fact that you may have problems getting life insurance, for example. But you asked me about the different types, and there are, of course, several other types of thyroid cancer which are more difficult to treat. Some differentiated thyroid cancer is resistant to radioactive iodine. This is called iodine resistant cancer, and there's also a very aggressive variant called anaplastic thyroid cancer, which has a fairly dismal prognosis. And there are tremendous breakthroughs happening at the moment to identify the genetic causes and to target these genes using highly specialized new drugs. So there is hope for these types too. And on behalf of the Thyroid Cancer Alliance, I'm involved in several European networks, which helps to keep me abreast and keeps me in dialogue with people to learn more about these new treatments. For example, I'm a representative in an EU network called Eurocan, and I'm the patient education representative, patient advocacy representative, I should say, for thyroid cancer in Eurocan, which is very helpful.
So you mentioned that you had two surgeries a number of years, was it years apart?
It was about 17 years apart, yeah.
17 years, yeah. So what other treatment did you have then? Did you have radioactive iodine?
The first time I had surgery, and that was it. And I was told to take 2 little pills for the rest of my life. And the second time, I had what they call completion surgery, followed by radioactive iodine. And I was in Holland at the time, and my treatment consisted of going to an iodine room at the University of Leiden. And I was locked away there for 5 days with only the telephone to communicate with family and friends.
Yeah.
And the treatment I have now consists of taking levothyroxine for the rest of my life. I see a specialist every 6 to 12 months to review the dosage because, as you may know, there have been some changes in the way the various brands of levothyroxine are made, and these changes can affect your blood test results.
Yeah.
So he likes to take a look at my blood test results every 6 months or so.
Mm-hmm. Yeah, it's funny, I saw something on social media today from a thyroid cancer survivor in America, and she'd had a t-shirt printed that said, "We did isolation before it was cool."
Yes, I like that.
You know, I mean, obviously, I did the radioactive iodine, and you know, I had it at the teaching hospital local to me, and I was fortunate. It was a nice room. I had a TV and a DVD player, and you know, internet access and things like that. But there really is nothing like when they close that door, is there?
Not really, and I was on my own, and I think most people in England are on their own.
Yeah.
But at the University of Leiden, where I was treated, they actually used to take 2 patients at a time.
All right.
Them for going into the iodine room, with the idea that they will go into. So I should have had someone in the second bed. The person I was going in with was declared treated and was allowed to go home. So there I was on my own. I did have a fridge and a television and a comfy chair, and the previous patients had left all sorts of bits and pieces of knitting and crochet.
Yeah, same in mine. Lots of puzzles and decks of cards and magazines.
Yeah, that's right. Yeah,
and a couple of books. Yeah.
A lot of thought goes into making these rooms as friendly as possible, and I think it's not as bad an experience as all that, looking back on it, but it's quite chilling the first time that you have to go through with it.
Yeah, it is. And, you know, I thought that I would be absolutely fine and that I was prepared. And, you know, I was very upbeat and, you know, just get this done. And, oh, you know, it'll be nice to have kind of a few days to myself and, you know, no school, you know, no kids to worry about, all that thing.
Yeah.
But actually it is quite, you know, that I remember being really upset that first night, just feeling really, you know, alone. But yeah. So I suppose when you were first diagnosed, at the age you were, it was kind of your parents supporting you through. And then, so the second time that you were diagnosed, who kind of supported you then?
Well, I had a lot of support from my husband, especially, and my family and friends, including some of my work colleagues. But I can remember that it was sometimes hard work telling people, because they would base their reaction on what their previous experience was of other friends and families having sometimes much more aggressive types of cancer. So it was really difficult to get over that. I had a really big breakthrough because I never knew anyone who had thyroid cancer. I went to the dentist one day and I had a reaction to the injection, which is actually related to the thyroid medication and being on a rather high dose of T4. So the dentist was quite surprised and he said, what's going on here? And I explained to him that I'd had thyroid cancer and he said, me too.
Oh.
And he had just had his treatment about 6 weeks previously. For some reason, he'd actually gone to America for treatment. And we kept talking and talking and talking, and it was just amazing to talk to someone else who'd had the same experience. So whenever I went to the dentist after that, I would make an appointment for the end of the day so that we could have a bit of a chat afterwards. And that's the first time I found out the importance of peer support, you know, talking to people who've gone through the same experience as you.
Yeah, and that's the key thing, isn't it? And you know, I hope all the awareness that we're kind of, you know, bringing this month, you know, will help to kind of expand that. And I know personally, I've made a lot of really good friends through.
Fantastic.
You know, through this kind of unfortunate. Well, it is, you know, this horrible event, but actually, you know, it brings people into your life and having that kind of common sense, you know, that common bond. So would you say that having thyroid cancer has impacted your work?
Well, I was working as a medical publisher when when I was diagnosed for the second time. And I was extremely fortunate because working for a medical publishing company meant that my colleagues could look up the information for themselves, and they were more grounded in understanding the disease and what I might be going through. So it didn't have so much of an impact on my work, but I have come across other people who have found it really hard to talk with colleagues or with their boss, and even fear losing their job, because sometimes you have side effects, or you're tired, or you may even get depression because of what you've been through. I think some of us go through a form of PTSD because it is quite a traumatic event in your life you have to learn to deal with. And so I do know that the experience is different for some people.
Yeah, and I think going back to what you said earlier about, you know, people having this misconception that it's the good cancer or that we should feel lucky. And I think that kind of feeds into it, that people don't realise that, yes, there is a good prognosis and there's a good chance that you will go through what you go through, and there will be a good outcome, but you've still gone through that, haven't you? And I think
exactly
that's the dangerous thing about people saying it's the good cancer, you're lucky to have that cancer, because it makes people even less aware of what somebody might be going through. And it might be weeks or months, might it, after having the initial surgery and the radioactive iodine and everything. And I know for me, in my case, that did kind of happen to me. I was upset when I was diagnosed for about 24 hours, and then I kind of went into let's get this sorted mode, and as long as I had dates and times and I knew things were happening, I coped well. And I had my radioactive iodine in the November, and it wasn't until the January that I kind of fell apart, for want of a better word. When it's over and you just have that moment to sit down and think, has all that just really happened? And it's...
I think there's another aspect to that too, that when you're going through treatment, you're busy all the time, and you're having tests and you're seeing doctors, and suddenly at a certain point that all stops. And that was when it hit me. I remember I used to wake up in the morning still feeling different. There was a before and after diagnosis, and it took me months and months, possibly even a couple of years, before I woke up for the first time and having thyroid cancer wasn't the first thing on my mind.
So how have your family and friends supported you then? I know you've already mentioned your husband, so.
Well, my son was very, very young. He was 1 year old when I was diagnosed, and my daughter wasn't even born. And a few of my friends knew, and they were there to listen. And I think that's probably the most important thing that you can expect. Is for people to listen. And you don't want them, as you've just said so eloquently, you don't want them to belittle it by saying, oh, but it's so easily treatable. And you also don't want them to overestimate its impact and think that you're going to die next week.
Well, and that's the thing. I mean, and they're the extremes, aren't they? That again, I can remember when I was diagnosed, and we live in quite a small town, and obviously somebody had told someone who told somebody else. It's a small town, everyone knows each other, and my husband went out one evening and saw one of our somebody that we know, just kind of from the local pub, and he said, oh, I'm really sorry to hear about your wife. Is she in the hospice yet?
Oh yes, that's exactly.
Like you said, it's just those extremes, isn't it? It's quite unusual. So my next kind of question then is quite interesting, because you weren't told the first time. So it would have been, what do you wish you'd been told when you were first diagnosed?
Oh, everything. I think that I would have wanted to be told that I had thyroid cancer, that it was a treatable form of cancer, that I was probably going to outlive people because I was having all this extra attention and medical checkups. There's a certain amount of truth in that, because along the way, I've had other things diagnosed that might have been missed if I hadn't been having regular checkups. But I think it really is important to have good, reliable information and support, and information about how to contact patient support groups. Because talking with other patients is one of the things that gets us all through it.
Absolutely. It's invaluable, isn't it? So what would you say now if you met somebody now who told you that they'd just been diagnosed? What would you say?
I think the first thing I would say is don't be afraid to ask questions of your doctors. Write your questions down beforehand, and take someone with you when you go and see your doctor, so that they can remind you of your questions, but also remember what the doctor says to you. And just don't be afraid to seek out support groups, talk with your friends and family. And there's a better understanding now of cancer, and people know that so many types of cancer are more treatable. I've just remembered something that perhaps it might have been relevant to mention before. My boss, when I was working, of course, he knew I'd been diagnosed with thyroid cancer, and he went off to see one of our authors in the cancer field, and he came back and said, "Judith, I've just seen a poster on the wall of this hospital, and it says 40% of cancers can be cured." And that was just so uplifting and encouraging.
Yeah.
That was back in the early 1980s, when people still didn't really understand that cancer was treatable. So that made a huge difference to me.
Fabulous. So is there any advice you'd like to give to health professionals then, treating people?
I could write a book about it, probably.
You may well do.
I think that what we need health professionals to understand about people with thyroid diseases or any other disease is treat the person, not the disease.
Absolutely.
We're not just a bunch of numbers. Listen to our concerns, answer our questions, and if there's too little time, as there often is, you've got a very short time to see your doctor, refer them to a good patient support group. Or sometimes some hospitals will have a specialist nurse that you can talk to and just dump on.
Yeah.
Because often the specialist is too busy to listen to everything.
Absolutely, yeah. And I think for seeing any doctor in a hospital, time's a premium, isn't it, these days?
Mm-hmm.
So would you say with kind of the work that you do now, and thinking back probably to when you were first diagnosed, do you think people are becoming more aware of the thyroid?
I think we always used to say that most people didn't know where the thyroid gland was or what it did until they were diagnosed with a thyroid disorder.
Yeah.
It could be an overactive or underactive thyroid. I think people are becoming more aware. I think the patient organizations have contributed a lot to improving awareness and giving information and support to people. And I think that's also true for other types of cancer. So I would like to think that the work I'm doing and other people in the thyroid cancer patient community is doing has made a real difference.
Yeah. Okay, so tell me a bit more about the thyroid awareness walk that you did then.
Well, this was 6 years ago when the Thyroid Cancer Alliance decided to walk the last 110 kilometers of the Camino de Santiago. Have you heard of that? The European Thyroid Association was holding its annual medical meeting in Santiago de Compostela, and 30 of us decided to do this walk. The Spanish patient organization did a tremendous amount of work to organize it, find us places to stay along the route, and put on a great event in the square at Santiago de Compostela when we arrived. and we were greeted by some of the people who were going to be going to the meeting. We also went into the cathedral service. We all wore purple shirts, our Thyroid Cancer Awareness shirts. The Thyroid Cancer Alliance was one of the sponsors of the event. And it was a tremendously moving event. I mean, walking along with other survivors for that great distance, it took us, I think, 7 days, was just a remarkable experience, very moving, something that I will never, ever forget.
Yeah, it sounds amazing. Amazing. So, how do you feel about this then? How do you think this video experience has gone?
I'm really self-conscious about the way I look, and I'm always apprehensive about being on video or even having photographs taken of me. So I'm not enthusiastic about that, but I've really enjoyed this chat. I think it's brought out some really interesting things.
Yeah, and you know, I think the long-term plan, isn't there, to kind of build a library of these. And I think that, you know, again, you know, people who are visiting the website, you know, it's really useful, and it's more informal, isn't it, than, you know, than just kind of reading a leaflet or a web page. Yeah. So we're kind of halfway through Thyroid Cancer Awareness Month now. So have you got any plans for the next couple of weeks?
Well, me personally, I'm preparing to host something called the Thyroid Cancer Cafe on Zoom, and what we're doing, as you may already know, is that we're inviting people to bring their coffee and to join a Zoom conference call and just talk pretty much freely about their thyroid cancer experience, ask any questions that they may have. Perhaps we'll look at some particular issues, like, for example, many of us have been through what's called the low iodine diet. When you talk about what's your experience, how did you manage? Did you do that? Did you do this?
Yeah.
You did?
Yeah, I did do it, yeah.
Yeah. So that might be one of the things we'll talk about, but also how you feel generally. How has it impacted you psychologically? Do you have an opportunity to talk to other people? So lots of things we can talk about. And the idea for a thyroid cafe was actually started in France by someone I know quite well, Beate Bartes, who is the president of the French thyroid patient organization. And in France, they have a monthly or thereabouts meeting of thyroid patients in 2 cities where people just sit and chat and talk about their issues and ask questions and support each other. That idea has been taken up in several Latin American companies, I believe. And I thought it would be interesting to use the Zoom facility to get people to come onto Zoom and talk with each other. It will be completely confidential. We're not going to record it except for training purposes.
Yeah.
We're not going to put it online. We're not going to give medical advice. I think it's really important.
Absolutely, yeah.
We don't tell people anything about their diagnosis or treatment. You give them back to their doctor, but you can give them support and help them to ask the right questions of their doctors, for example. So I'm really looking forward to it. I think it's, I'm not aware that anything like this has been done before. I don't know whether we'll ever do it again. I hope.
I hope, you know, I'm really looking forward to it, and you know, I hope it's a success. And you know, Zoom again, it's like going back to social media, isn't it? Zoom has its good points and its bad points, and I suppose the fact that it's on Zoom now and that it's not a physical meeting kind of throws it open to more people, doesn't it? So
yes,
I'm really hoping, you know, that you know, a lot of people come, and you know, I do think it'll be really interesting. And like you've said earlier, there really isn't anything like talking to someone who understands, who's been in that position, you know, who's been, like you say, who's done the low iodine diet and stood scratching the head at the cupboard going, what can I actually eat?
yeah,
And how many days is it until I can have some cheese and biscuits?
yeah.
So, yeah, we've all, you know, we've been there. So yeah. So that's the end of my questions. So thanks ever so much.
Well, thanks to you too, Joanna. It's been great fun chatting with you.
Yes, and I will see you at the Thyroid Cancer Cafe.
Yes, you will. That's in just less than 2 weeks now, isn't it?
Yeah. I've got all my link and everything. So
okay, right.
Brilliant. Thanks ever so much.
Thank you, Joanna, and bye. Have a good day.
Bye.